Good morning, everyone. I'm sorry I cannot be with you in person today, but I'm honored to be part of this important conversation. Thank you to Gift Maki and the Ghanaian-Diaspora Nursing Alliance UK for the kind invitation to contribute to this summit. I also want to thank Professor Winston Mano and the University of Westminster for hosting this event. Today's theme, Voices of Change, Building Systems that Empower Nurses for Excellence, is timely and deeply personal to me. It's especially important because of the enormous contribution of global majority nurses and nurse leaders across the NHS and the wider health and social care system. Wherever you go in healthcare settings, adult social care, education, research, and regulation, global majority nurses continue to strengthen care, safety, resilience, and innovation. My own journey started many years ago as a frontline cardiology nurse. I later moved into clinical and academic research, then education and training, compliance, governance, and digital health systems. Today, as CEO of Landmark Systems, much of my work focuses on helping health and social care organizations to build better systems for education and training, governance, and compliance. My message today is simple. Outstanding care requires good systems. Not systems that control nurses, not systems that add more bureaucracy, but systems that genuinely empower nurses to provide safe, compassionate, evidence-informed, and outstanding care. I also argue that excellence is not just an individual responsibility. In health and social care, we tend to celebrate individual excellence. The nurse who stays late, the ward manager who holds everything together, the educator who supports newly qualified staff, the senior nurse who advocates for patients when the system is under pressure, the internationally educated nurse who brings skills, resilience, cultural intelligence into a system that doesn't always make belonging easy. We should celebrate those contributions. We must also be honest. Too often, health and social care systems rely on individual heroism to compensate for organizational weakness. When systems are poorly designed, nurses carry the burden, whether through duplicated work, outdated policies and procedures, fragmented training records, unclear escalation routes, poor access to information, audits that do not lead to learning, and digital systems that sometimes make work harder than easier. That is not just an efficiency problem. It's a patient safety issue. A nurse should not have to be exceptional just to survive a shift. And if we want outstanding care, we must design systems that make safe, effective practice easier and more sustainable. That means we move away from a culture that asks, why did this person fail? To a system whereby we ask, what did this system make difficult, unclear, or unsafe? The shift does not remove professional accountability. It places accountability in the right context because people deliver care, systems shape care, and leadership improves care. So a little bit about my own journey. I started out in cardiology in the early 2000s at a time when the specialty was changing rapidly. We were seeing major shifts in acute cardiac care from thrombolysis and traditional pathways towards primary PCI, catheter laboratories, specialist cardiac day units, advanced diagnostics, and better long-term management for cardiac conditions. Those improvements did not happen because one professional group simply worked harder. They happened because systems changed. Pathways, evidence, technology, training, clinical leadership, multidisciplinary working all changed. The impact on patient safety and outcomes was significant. Faster diagnosis and interventions, better survival rates, better long-term management, and improved quality of life for many patients. That experience taught me an important lesson. Technology can transform care, but only when the systems around it are strong. The cath lab does not improve outcomes on its own. It needs skilled professionals, good protocols, training, governance, escalation routes, audits, leadership, and teamwork. The same is true for digital systems and AI. AI alone will not improve health and social care simply because it's powerful. It will improve health and social care only if we build strong foundations around it, strong governance, good data quality, strong clinical leadership, education and governance, strong patient safety oversight, and strong nursing voice. Nurses must not be passive recipients of digital transformation. Nurses must be active shapers of it, especially global majority nurses who bring experience, insight, and leadership across different health systems, communities, and cultures. So let's talk a little bit more about digital systems and what they should do. So, what should effective digital systems do for nurses? They should help nurses make better decisions sooner at the point of care. That is where digital systems matter the most, not only in board reports or compliance dashboards or audit trails, but in the moment when nurse needs the right information, the right policy, the right escalation route, the right evidence, and the right clinical prompt, right there at the point of care. Effective digital systems should reduce administrative burden and duplication. They should improve access to information, policies, procedures, clinical guidance, training requirements, escalation pathways should be easy to find, easy to understand, and easy to apply. They should support training and competence. Outstanding care depends on a competent workforce. But competence is not just completing mandatory training once a year or every 3 years. It's about relevant learning, practical application, supervision, reflection, and continuous development. Digital systems should strengthen governance and assurance. Good leaders need to know where the risks are. For example, who is trained? Where are the gaps? Are policies being read and applied appropriately? Are incidents leading to learning? Are audits changing practice? Are improvements actually happening? This is central to patient safety. At board level, patient safety requires collective leadership and proper clinical oversight. But for assurance to be meaningful, leaders need reliable evidence from the front line. And that is where good systems really matter. This is also the thinking behind platforms such as Comply Plus, which we developed ourselves, where we bring together learning and development, policies and procedures, compliance evidence, and governance tools to help organizations move away from fragmented, reactive compliance towards more integrated assurance. When systems are joined up, leaders can see more clearly. When leaders can see more clearly, they act earlier. And when they can act earlier, patients and staff are safer. We also need to talk about AI. Artificial intelligence is no longer a distant idea. It's already entered healthcare through many different avenues, including documentation tools, clinical decision support systems, risk prediction tools, workforce planning, diagnostics, education, policy research, quality improvement, and administration. Used well, AI can help nurses in many practical ways. It can summarize long documents, make policies easier to search, support reflective learning, identify training gaps, support audit analysis, flag patterns in incidents or complaints, help leaders move from reactive firefighting to earlier interventions, and make revalidation evidence easier to organize, reflect on, and apply in practice. For advanced nurse practitioners and senior clinical nurses, AI-enabled diagnostic tools may support safer and faster decision-making, but only when properly validated, clinically governed, and used alongside professional judgment. They can help interpret clinical data, highlight possible risks, support differential diagnosis, prioritize agency, and guide escalation, much the same way as we used to do with the early warning systems, but much more powerful. Used properly, these tools can strengthen clinical reasoning, not replace it. AI-enabled ambient scribes are another practical example. When safely governed, they can reduce documentation burden by helping capture consultations, structure clinical notes, and support more complete records. That matters because documentation is not just administration. It is part of communication, continuity of care, accountability, and patient safety. But the key phrase is safely governed. Nurses are guardians of patient data, patient dignity, and patient safety. So AI must support professional judgment, not replace it. AI must strengthen care, not dehumanize it. AI must reduce burden, not create new risks. AI must support equity, not amplify bias. AI must be governed, not simply deployed. This matters, especially for global majority communities and staff. If data used to design AI and to train AI is incomplete, biased, or poorly understood, AI can widen inequalities because all of us are also users of health systems. If AI tools are adopted and implemented without diverse nursing voices, they may miss the realities of the people and communities that they are meant to serve. So my message on AI is this: do not start with the technology. Start with the problem. Ask the following key questions. What problem are we trying to solve? Whose burden are we trying to reduce? What evidence shows this tool works? What risks could it introduce? What patient safety controls are in place? And who is accountable if something goes wrong? How are nurses involved in design, testing, procurement, and evaluation? And finally, how will we know whether it improves care? Those questions are more important than any marketing claims from vendors because AI will shape the future of healthcare and social care, but nurses must shape AI. So here's the leadership challenge. Because the biggest digital challenge in health and social care is not technical, it's leadership. We can buy software, introduce AI tools, create dashboards, and automate reports. But if leadership culture is weak, technology will not fix it. If there's no trust, staff will see digital systems as surveillance. If there's no learning culture, data will be used to blame. If there's no inclusion, AI will reinforce existing inequalities. If frontline professionals are not involved, systems will be imposed rather than adopted. That is why nurse leaders must be involved in digital and AI procurement decisions, not brought in at the end to help with implementation. They must be involved from the beginning, from problem definition and procurement to risk assessment, governance, staff engagement, and evaluation. Nurse leaders understand workflow, they understand patient safety, staffing pressures, documentation burden, safeguarding, escalation, dignity, culture, and trust. Those are not minor implementation details. They are the conditions that determine whether digital transformation succeeds or fails. This is where GDNA UK and other diaspora nursing networks are so important. You bring together nurses with lived experiences across different systems, cultures, countries, and professional journeys. That gives you a powerful voice. The next stage is not just representation within existing systems. It's shaping better systems, systems of the future. Global majority nurses must be involved in digital transformation, AI governance, research and development, education and training, policy development, workforce planning, and indeed leadership. Not as an afterthought, not only as users, but designers, decision makers, system leaders. So let me close with a simple framework. When we think about digital systems and AI in nursing, we should ask 5 key questions. Does it empower? Does it reduce the burden? Does it improve safety? Does it strengthen accountability? Does it protect humanity? So we should ask whether the AI systems are going to make nurses more capable, confident, and better informed. We're also going to check whether they're going to help save time, reduce duplication, and remove unnecessary friction. They also have to help identify risks and support decision escalation and strengthen learning. They should also help us make expectations, evidence, and responsibilities clearer in practice. They should help us preserve compassion, dignity, professional judgment, and trust. If the answer is no to any of the questions, we should pause, because not every innovation is an improvement, and not every digital system is progress. Progress is when technology helps people do meaningful work better. Progress is when systems support the professional, not the other way around. Progress is when nurses have the tools, voice, and authority to lead change. So, my final message is this: outstanding care requires good systems. Good systems require courageous leadership. And courageous leadership must include the voice of nurses, especially the global majority nurses, whose contribution to health and social care is already profound, and whose leadership will be essential to the future. Thank you all again, and I wish you a successful and inspiring summit. Also, I hope we can connect on LinkedIn and carry on these conversations. Thank you.